So I know that you have been successful in publishing many papers, but you have not been able to get any of your own research published. Why do you think that is?
It's a question that I've had to grapple with um, over the years because it's been a recurrent problem. And sadly, of the papers I've published, those that consisted of my original research had much greater significance and import uh, to healthcare, actually. And you know, once I'd published some papers, I really thought that it was a matter of getting established, especially when you're an outsider and you're a full-time clinician that has an interest in research, which was the case for our researchers years ago. Most of them were clinicians back in the old days, but clinical medicine and academics split years ago, and I think it's a very, very unfortunate thing that happened. But so I thought, I just had to get known, established, and unfortunately, after those some of the original papers were published, when I published one of my original papers over a quarter of a century ago about the connection between low testosterone and prediabetes or metabolic syndrome that we found in a naturalistic setting that I practiced in, um, I literally got a response back in 36 hours, and in those days that meant by fax, and it was obvious that it was not read. And this had happened a number of times, and when my father came in, my senior partner, and when I told him about it originally, I could tell from his expression, he's very stoic, but um, that he had his doubts, but he wanted me to do it. And he came in later and asked me how it had gone. And of course, I said, I think you know how it went. And he said, so it didn't go well. I said, no. And he said, what do you think? I said, you obviously know. Why don't you tell me? He said, well, what was different with this paper than your other papers? I said, it was a paper, Dad. I mean, what do you mean? What difference? And well, what did they want? From you, my paper, nothing else, nothing else. Well, there's a cover sheet. So what they want on the cover sheet, my names and my affiliations. I remember him shaking his head, and I said, no, no, but that can't be now. I mean, I have spoken and taught all over the country, outside the country. I've been on national and prestigious boards as an expert. I've been an expert witness in court. That can't be. I said, and why now? And he said, well, what's different between this paper and the other papers you publish? I'm like, oh, Lord, just tell me. But he wouldn't. I said, well, let's see. I had other authors. Who were they? Full-time academics. Bingo. He said, anything else different? I said, well, in some cases, there were grants that supported what we were doing from the pharmaceutical industry. He said, those boys pay their bills at those journals for advertising. They know they better damn well at least read it before he said, when you send somebody back the response you got, clearly they're sending you a message. They at least could have waited a little bit or act like they were a little interested. They're making sure you understand that when you're not involved with someone from academics, when there's not support, they'll remind you what they really think of you. And that was really difficult. And what he meant, not me personally, but how often academics as a whole, I want to emphasize, looks at clinicians, people who see patients, and as far as not believing they have any role really in research, and it's frankly had tragic consequences for the profession and for the advancement of medical science. And again, I want to note there's a lot of exceptions. I've had the pleasure of working with some incredible academics that care deeply about patients and want clinicians to be involved because they understand the need of that if they're going to be able to do things and to have research and papers and advance the cause of care for the sake of patient welfare. But unfortunately, this is still an issue. And so when I got this back, I knew that you know obviously things have changed. I'd even sent and asked advice of people who are academics and are of that minority of really noble people, and did their best to give me ideas on how to word things, etc. And every one of them, when I sent back and showed them the responses I got, I won't use some of the explicatives that they expressed in their emails, but made it clear to me that that was exactly what was going on. It's because of who I am, not because of the quality of the information or the importance of the issue that I was addressing or my level of background. I mean, I'm probably, I may be the old man when it comes to being a clinician in sex hormones in men and women. There may be other people that have been involved, not just clinically, but also from a research standpoint for over 35 years in the United States. But back when I got involved, it was a Rodney Dangerfield area of medicine. There was almost nothing going on at all, and we certainly got nothing in medical school. But so that it's been a difficult thing, and it presented to me ethical, moral issues when many of the things that we've studied and looked at and still have never been published that have significant implications for the well-being of patients that could lead to people who are better and smarter than I and in a better position to study them further. They could take those things and advance care in areas. In fact, for example, finally is years and years later, what I was saying that was considered heresy about testosterone and diabetes and metabolic syndrome, that's no longer the case. In fact, it's interesting that some of the people involved in that were individuals that acted like I wasn't making sense when I first brought up the possible connection 30 years ago. But be that as may, the important thing is those things are advancing. But the sad truth of it is they could have advanced much, much faster. This is the same issue we dealt with in obesity. I was a heretic also in saying that it was a medical problem, not a behavioral problem, and that if we would simply study it, we would find the underlying mechanisms, be able to target them, and have effective treatments. At one time I thought I was going to die before that medievalism went away, that was inhibiting that kind of research in medicine. But thank goodness it's here. I'm grateful for that, and I'm excited about it. But there's no question that it should have happened much, much, much sooner.